Good afternoon, everybody. Good afternoon and happy Friday. We made it through another week together of coronavirus, and I'm happy to be with you all this afternoon. So, as I do every day, I want to thank you for tuning in. I want to continue to urge you to keep yourselves informed. That's going to be more and more true over the next couple of weeks. I'm going to be making a lot of announcements every day around how we're going to be able to get back to work, how we're going to slowly reopen our economy, a lot of detailed announcements, and the details really matter. So if you're tuning in every day, great, keep doing it. If you're not, I would recommend that you do, because we're going to start to get into a pattern of every day a little bit more information, and it'll be important for you to digest that so you can keep yourself safe and as healthy as possible. We'll begin with the cases. You can see the cases on the screen, the data on the screen. We're reporting 341 new cases today. And as per usual, Dr. Nicole Alexander-Scott will go through the details. As I've been saying for the past week or so, we seem to have hit a plateau, and that is definitely good news. We're still not in a decline, which is where I wish we were, but we'll take the plateau. You know, we're not out of the woods, certainly not out of the woods. And by the way, as we continue to do more testing in vulnerable communities, in the inner city, in our nursing homes, you know, it's clear that we're not out of the woods. But the fact that you can see on your screen a leveling off is a testament to your hard work and our hard decisions. And it should let you breathe a sigh of relief. A plateau, a flattening. From day one, we've said we want to flatten the curve. Well, we've done that. And so I want to thank you for your cooperation. And although we're not out of the woods, just take a breath. Take a breath with me that we're doing the right things, and we're doing a good job, and we are in a good place. Okay, I want to start to set some expectations about what we're going to be doing together over the next couple of weeks. So, as a reminder, I have a stay-at-home executive order in place now in the state of Rhode Island. That is set to expire on May 8th. And it is my hope at this point to be able to let that expire on May 8th. Now, I want to be clear about this. That is not a foregone conclusion. I have said that every time, but I'm going to continue to reiterate it. You may know, and others have noted to me, that Massachusetts has extended their stay-at-home order, Connecticut has extended their stay-at-home order, New York and New Jersey have extended it. And I hear that, I understand that, I'm talking to them, and I'm looking at their data, and I'm looking at our data. I'm never going to do anything that I believe, that we believe, is unsafe. Having said that, we look at the data every day, and it isn't just the aggregate data of cases or hospitalizations. It's also, you know, the ability of our system to deal with the crisis. Are we able to test everybody in nursing homes and communal living situations? Are we able to test everybody in the Latino community and hardest hit communities? Are we able to act quickly enough and take care of people if there is an outbreak? And from everything I see now, if we continue to stay on the path that we're on now, which is to say a plateauing and maybe even a decline, then it is my intention to let that stay-at-home order expire on May 8th. I do want to say this. We know that the data and the plateauing is extremely sensitive to the behavior of Rhode Islanders, which is to say, if you go out this weekend and next week when the weather is nice and warm and sunny and everybody congregates in the park and people start to sneak back into their offices, and we don't wear our masks, and we don't obey the stay-at-home order, then it's almost certainly the case that I'll have to do what other governors are doing and extend our stay-at-home order. And I really don't want to do that because too many people are struggling and are out of work. So, as I've said every day, please hang in there a little longer. We're on a good path. We're on a safe path. Obey the stay-at-home order, as we all will do, until May 8th. And I hope that on May 9th, we can begin a slow process of reopening our economy. To that point, I'd like to make some announcements now that I hope provide you with a glimmer of hope of where we're going. So I announced, I think last Friday, that I was asking DEM Director Janet Coit to work with the team around the reopening of our parks and beaches. And I'll say one of the difficult decisions I've had to make in the past month is deciding to close our parks and beaches. That was a tough one because I hope everyone can spend some time outside every day. I still hope that and encourage that. And also, one of the best things about Rhode Island, the Ocean State, are our parks and beaches. So the good news is we're planning for a phased reopening. And like every other announcement that I'll be making in the next 2 weeks, it's phases. It's phases. I have often said reopening the economy won't be a flick of the switch. It's not putting the light switch on. Think of it more like a dimmer on a light. We're going to slowly turn the lights back on. So let me give you a sense of what phase 1 of opening parks and testing the waters will be like. When we begin phase 1, which I hope is May 9th, we'll be reopening some parks, including Lincoln Woods, Haynes Park, Snake Den, Beavertail, and Fort Adams. By the end of the day today, there will be a full list of the phase 1 parks to be reopened on the DEM website. So you can, by the end of the day today, check out the DEM website. You can look for the park that is near you. And if it's on the list, it means that on May 9th, when we start the reopening, hopefully, those parks will be reopening. It's not going to be just reopening the park. We're going to be reopening with reduced parking capacity to promote social distancing and with increased enforcement to make sure we enforce the social distancing. So in phase 1, you'll be able to go to the park. You'll be able to drive to the park and park your car. You could take a walk. You can go for a run. You can go with your immediate family and friends, that small group that you're being with these days. But you're not going to be able to do things like have a cookout or have a huge football game or any kind of organized sports in the park. It's going to be, and you should probably limit your time so that everybody has a chance to enjoy the park. But you can go with your family, with the people you've been with. You can park your car, and you can enjoy the outdoors. The name of the game in this phase 1, whether it's parks or anything else, is just take it easy. Go slow, test the waters, whatever helps you think of going slow is what I want you to think. Just gently get back out there so that we can do it safely. 6 feet apart. We still want to be staying 6 feet apart. If you go to the park with your family, you want to play ball with your family, that's great, have fun. For other people that you see there that you don't know, 6 feet apart. No pickup basketball games, no pickup sports games, but go outside and enjoy it and get some exercise. In phase 2, we'll relax some of that guidance. Many of you want to know about the beaches. Yesterday I had a press conference for kids, and we had thousands of questions, and many were about, can I go to the beach this summer and go swimming? So in phase 1, we are not going to reopen the beaches just yet. However, in phase 2, we will look to do that, which will be coincident with Memorial Day anyway, which is about the time that we're looking to go back to the beach. There will be new restrictions about parking, new restrictions about how to use pavilions and bathrooms and such. So I'm not prepared today to give an announcement on that, but I want you to know we're working on it. And for those of you who want to know, can we go to the beach this summer? The answer is going to be yes, assuming we stay on a good path. And we'll be back to you with more guidance around how to do that safely and in accordance with social distancing. So I hope that provides you a glimmer of hope. We aren't there yet. We can't go all rushing out to the beach or the park tomorrow, but we're going to get there. We're going to get there, and we can all look forward to that time and maybe start now thinking about a nice day on the beach, and that'll get you through a dreary day like today when you're stuck in your house. Okay, I want to take a minute to talk about childcare. I want to begin by recognizing how unbelievably difficult this pandemic is for families and for working moms and dads. I know how hard it is, and I just want to take a second to let you know that I wish we could do better, and I wish I could do more to make it easier for you. For those of you who are lucky enough to still have your jobs, it's still incredibly hard to be working at home, your kids at home with distance learning, and no child care. For those of you who've been laid off, it can be doubly difficult. So I do want to try to stand up childcare again. We are going to do that. Closing schools and closing childcare were some of the hardest decisions I had to make. But at the end of the day, public health experts said, and I know they're right, it was the only safe option. Leaving child care centers open would have increased the state to a much greater spread of the disease. Having said that, I don't want to keep them closed a second longer than necessary, and I know that as people start to go back to work, we have to open childcare. So as I said earlier this week, and as I'm going to say again, same thing, think of the light switch. We're going to slowly turn up capacity in childcare. To get us there, DHS, run by Courtney Hawkins, has asked child care providers to submit their plans for reopening by May 22nd with a targeted reopening date of June 1st. Child care facilities, to give parents a sense of what's coming and a sense of confidence, child care facilities are going to be operating under a whole new series of guidelines and restrictions, very stringent restrictions to make sure your children and their caretakers are safe. There's going to be reduced group sizes of 10 or fewer, stable groups, so the kids interact with the same kids and the same teachers every day, different staffing plans. We'll be following CDC cleaning guidelines, new drop-off and new pickup protocols, temperature screening for kids, a whole bunch of new design features so that we can keep everybody as safe as possible. We're going to be asking a lot of our child care providers, and we're also going to be asking them to spend more money in order to comply with these new regulations around cleaning and mask wearing and the like. So as a result, to support them and to enable this and to make sure they have the resources they need to keep your kids safe, we're going to be temporarily raising the child care rates for child care providers in the CCAP program. I want to be clear about this. I want to get this done by June 1st. We have a plan, and we're managing our team to a plan to reopen child care with less capacity in a targeted way with new safety regulations by June 1st. Having said that, this is a tall order. It will be ahead of many, if not all, other states. So please forgive us if we don't quite make June 1st. But let me be clear. We're going to do everything we can to get done by June 1st, because I know you need it. I know people need it. I know, especially if you're getting back to work, you need some child care. I want to thank not only Courtney Hawkins and her team, I want to thank all the child care providers for what you've done and for what you're going to do. This is the beginning of what we're all going to have to do. Change the way we work, change the way we schedule shifts, change the number of people who can be in a room, think about cleaning, constantly, especially in the instance of childcare, having fewer surfaces around for people to touch. So we're going to do it. We're going to stand childcare back up. We're going to stand this economy back up. We're going to use our beaches and parks again. But I want everyone to start understanding, really understanding, that it's going to look different, it's going to feel different, it's going to be difficult, but it's what we're going to do, and we're going to do it together, and we're going to be stronger for it. Okay, also on the theme of slowly reopening our economy, I'd like to take a minute to talk about elective and non-critical surgeries and procedures at hospitals. So first, I want to begin with a thank you to hospitals. They've been phenomenal through this from day one. We're throwing a lot at them, and they're responding beautifully. One of the things that we did in Rhode Island and in every other state in America was to ask hospitals at the beginning of the crisis to stop doing non-critical procedures. That was necessary while they built up their capacity of PPE, testing, additional equipment, ventilators, etc. Now, due to our good work, we're getting to a place where we want to allow them to start reopening for elective surgeries, procedures, and non-critical procedures. I do want to recognize that that decision has caused extreme financial stress for our hospitals and also extreme inconvenience, to put it mildly, for patients. So if you're a Rhode Islander out there who's been waiting for more than a month for a surgery or a procedure or a test that you thought was going to happen in the end of March or beginning of April, I'm sorry we had to do this, and I realize it's been incredibly difficult for you. I told you we'd get you back as soon as we could, and today I'm telling you that's going to be very, very soon. We asked last week for all hospitals to submit to the Department of Health their plans to reopen for these non-critical procedures. I want to thank the hospitals. Every one of you got your plans in. They are excellent and just about being finalized with the Department of Health. We have a little bit more work to do this weekend as between the Department of Health and the hospitals. But I expect that starting next week, I'll be back up here making some announcements that certain hospitals are going to be back in the business, if not next week, the week after, with elective surgeries and non-critical procedures. And I want the public to know this. These plans that they've submitted are incredibly detailed. They take into account infection control, new workflows, new procedures, more testing. None of us is going to allow you to go back to a hospital if we don't think it's safe, which means that next week when I start making announcements that different hospitals are up for elective surgery, I want you to have confidence that it is safe for you to go, so that when you start hearing from the hospital about rescheduling procedures, I want you to have confidence to know it is safe and you should go and get the health care that you need and deserve, and that'll help you get better. One final note on hospitals, and this is something that the health department has been saying, and I know Drs. Babineau and Finale have been saying. If you're sick and you need urgent health care, go to the hospital or go to your doctor. If it's truly an emergency, go to the emergency room. If you need to see your doctor, call your doctor and go see the doctor. Doctors' offices are open. The hospitals are absolutely open. We have seen a decline in ER use and people showing up. So if you're sick, if you need to see a doctor, don't stay home and get sicker. Call your doctor, go to the ER if it's an emergency, and make sure you get the health care you need. Finally, I want to make one announcement about debt collectors and whether they can go ahead and seize your stimulus check. We have been hearing from a lot of worried Rhode Islanders who unfortunately have debt and have debt collection agencies on top of them to collect the debt. And they're worried that the debt collectors are going to start seizing their stimulus checks, just like a wage garnishment, that they'll be able to go in there and access that. I want you to know that's not going to happen. So if this is you and you're worried, take a deep breath right now and know that that isn't going to happen. And I want to give a big thank you and shout out to our terrific Attorney General, Peter Nerona. He's been working hard to understand this issue, and he has announced that he is prepared to enforce against debt collectors who try to access people's stimulus checks. The CARES Act does not allow for that, and he's prepared to protect you and make sure that debt collectors cannot access your stimulus checks. If you are worried or you're being hassled by a debt collector, call the Attorney General's office, the Consumer Protection Division, 274-4400, and he and his team will help you and, if necessary, take legal action against the debt collector to protect you. Now, I do want to say this. The purpose of the stimulus checks is actually to help you pay your bills. So, although if you're out of work, it's incredibly hard, and I know you're struggling, and you need this to buy food and keep the lights on. But on the other end of the equation, if you as a landlord who's also struggling to pay their bills and is a company that is in trouble, so try to use your stimulus check to pay the bills, to pay your rent, to pay your utility bills, to keep current on your bills. That's what the money's for. We don't want you to get behind on your bills more than necessary. And for that money to stimulate the economy, we need to use it to pay our bills to keep stimulating the economy. Having said that, the purpose of the stimulus was not to enrich debt collectors, so we're not going to let that happen to you, and we're going to protect you. With that, I'm going to turn it over to Dr. Nicole.
Thank you, Governor. Good afternoon, everyone. Thank you for joining us on this May Day. I'll start with the new numbers for today. As the Governor has mentioned, we have 341 new cases. This continues to be reflective of the expanded testing program that we have in place as a state that people are recognizing allows us to test the most per capita of our population in the country, also then results in identifying additional cases. Of our COVID-19 patients, 352 are currently hospitalized. Of those people, 76 are currently in intensive care units, and of the 76, 51 people are on ventilators. We will continue to see this slight increase and decrease in hospitalizations, but there continues to be consistently a decrease in people in the intensive care units and on ventilators, which is all part of the picture that's important for us to take into context and to make sure that we are staying vigilant, because it's the work that you all are doing that is helping us stay steady with going forward. As the Governor has said also, we sadly have 13 new COVID-19 associated fatalities to report. Our sympathies, thoughts, and prayers are with the families of these beloved Rhode Islanders who we have lost. One person was in their 30s, one person was in their 50s, 4 people were in their 70s, 5 people were in their 80s, 1 person was in their 90s, and 1 person was older than 100 years old. So moving on from today's numbers, I want to take a moment to thank members of our primary care work community. You all have been the heroes on the front lines. You have done and are doing everything needed to help Rhode Island get through this response, both in terms of COVID-19 preparedness work and being able to respond, and in terms of taking steps to continue to provide care to your patients. We've talked in the past about our immunization rates as a state and some of the declines that we have seen there. People have interpreted the stay at home, except for critical items that you need to go out for, to also mean pulling back from going to get their primary care needs met. And we want to make sure that you hear loud and clear from us that going to the doctor to get routine care or key elements of your health needs met are critical, essential items that you can go out and then come back home for through a stay-at-home order. It's critical that people stay connected to their healthcare providers. It's critical that pregnant women continue to go get their prenatal care services while they are walking through pregnancy. It is critical to make sure that our children and adults receive the vaccinations that they need to continue to stay healthy. If you don't feel well, if you think you need to call your primary care provider, don't hesitate. Definitely pick up the phone and call them. We want to make sure that that relationship continues to occur, that you can continue to get your primary care and other health needs met. It's why the governor, with her leadership, we've made sure that telehealth, being able to talk on the phone, is something that is possible. We are being creative in helping to ensure that you get to continue the relationship with your primary care provider. All primary care practices have managed this period differently, and all practices are going to take their own approach once we start getting back to functioning in a way that feels a little bit more normal. So it's important to check your primary care practice's website, call if you have questions, so that you can become familiar with the best ways to continue to get going again in seeing your primary care provider. The healthcare system and the primary care world are going to get busy again soon. And so we want to make sure that you can take advantage of this time, things that you may have postponed or just routine checks. Call your provider, set up appointments, get going now, ahead of the time in the first phase, so that you can make sure that you are first in line with engaging with your primary care provider, and that you can familiarize yourself with how you and your family's healthcare providers are going to be operating as we continue to take steps towards getting seen again. On a related note, in our appreciation for primary care providers, we want to continue to make sure, as we receive it, that you are prioritized with having the personal protective equipment, in particular the surgical masks that you need to be able to see patients safely. We very much appreciate that there are well over 30 respiratory clinics in place throughout the state, so that people who have symptoms that are concerning for COVID-19 can go to those respiratory clinics. You can either call an urgent care center near you, call your primary care provider, as some of them have respiratory clinics built into their practice, or go to our Rhode Island Department of Health website and click on the respiratory clinics information so that you could see the nearest one to you to be able to get evaluated and tested if you wonder about COVID-19 symptoms. With those separate entities available, we want to make sure that people who are not concerned about COVID-19 can still go safely to their primary care provider, and the providers have the surgical masks, personal protective equipment they need to be able to take care of you effectively. So we've sent out a form to specialty care providers and primary care providers for them to start ordering standard surgical masks, knowing how much we appreciate what you've been doing and how you are the prioritized group that we want to make sure you have in hand. It's an opportunity for providers and practices to fill gaps in their existing inventories for surgical masks in particular. As more personal protective equipment comes in, we're going to get more out to providers and additional types of PPE to providers, knowing that you are our priority group. We do just ask that providers using this new form be patient with us. We want you to receive the masks that we need, and we're going to get out as much as we can, as quickly as we can, and anticipate responding to the request of lots of providers, potentially all at once. So we will push out as quickly as we can in doing that. Before turning things over to Margie and the governor for questions, I want to make one last note about data. We've posted data online by zip code, and earlier this week I spoke about us posting rates online for our race and ethnicity numbers. Calculating rates lets us accurately compare populations of different sizes. I want to encourage you to go to the website so that you can learn and understand how this is impacting different populations. We now have rates posted for Rhode Island zip codes, with a huge credit to our GIS team and data team who've worked tremendously hard to make this available. We know that we are seeing a lot of cases in more densely populated areas, and people are now able to go on the website and do comparisons and see how different communities are impacted. That helps us understand how those social, economic, and environmental factors play out, where you have different levels of quality in education and housing and transportation in those communities. That's part of what we want to address as we work our way through this pandemic response, so that we can have communities bounce forward stronger and better on the other end of this. And with that, I'm going to stop so that we can get started with questions.
Good afternoon. Steve Alquist of Uprise RI is relaying a question from a frontline medical caregiver. Is the state providing any programs for struggling healthcare workers to support their mental health care?
Yes, so we are, and I'll take a second to go through that. If you have a mental health care provider already, it's important to know that through an executive order, I have mandated that telehealth, calling them, is covered, and covered in the same way as an in-person visit. I've also required insurance companies to waive pre-authorization so you can have quicker access to your mental health professional. If you don't have someone now, you could call BH Link, 414 Link, and that they will facilitate you so that you can find the right level of care that you need.
Our next question. Our questions are coming in real time from reporters all over southern New England. And the next is from Ryan Belmore of What's Up Newport. Governor, yesterday during the press conference, you said that when schools reopen, it would likely be with smaller class sizes. With many school districts facing huge budget issues, how can they afford the personnel to allow for smaller class sizes? Additional state aid, he asks?
Yeah, so all to be determined. I'm trying to get through phase one, which is to give everyone a flavor for it, a whole new set of guidelines, new sets of regulations, new sets of enforcement. That's phase one. Then we'll get to phase two. Reopening schools is like phase 3 or 4. So we'll have much more to say about that, later. But, it's going to be different. I don't know how it's going to be, but we're going to have to rely on technology. We may have to use some of our we will have to use some of our COVID relief funds to help schools in order to meet the necessary cleaning requirements. So it's going to be a whole new day in schools when we reopen, and I'm not prepared today to talk about exactly how.
Eli Sherman of WPRI Channel 12 says, yesterday the health department revised its data to show there were about 70 more hospitalizations than originally counted. Were you surprised by that change? And has that uptick changed the calculus behind your willingness to reopen the economy after May 8th? Why or why not?
The governor was aware of this change, as we've explained it, and it does not shift the overall timing for reopening. What we did with our system is take what was established during the throes of this epidemic very early on, where we had a comprehensive way engaging our infectious disease docs and infection control practitioners at each of the hospitals to collect information on hospitalizations. And that's how we were reporting out what our hospitalized cases were. As the number of hospitalized cases continued to grow, we have developed a process to allow for a more streamlined electronic submission approach to those hospitalized cases. And in doing so, we learned of some additional cases that may not have been captured by the providers who we were getting the information from. And part of that may be because there have been some hospitals that have started to screen all patients now for COVID-19. And so our streamlined electronic submission allows us to capture all of that more confidently now. We very much appreciate the extensive resource-intensive work that had been done previously, and we now have a solid way for continuing to collect it going forward through our system. That being said, that helped us identify a certain number of hospitalized cases. The increase that has occurred also may be due to an actual bump in hospitalized cases. It may be partially the screening that I've just mentioned, that we are now identifying more people who are in the hospital with COVID-19 as opposed to just people who are in the hospital because of COVID-19 or for COVID-19 related illnesses. Someone could have a sprained ankle, and if they are screened for COVID-19 and their test returns positive, they may be in the hospital with a sprained ankle with COVID-19. We want to make sure that we are capturing that data as well. That could contribute to some of the bump, or the fact that during the holidays earlier in April, when the weather was nice, some additional people did get out into the community. 10 days later or so is when you would see the change in numbers in our data because of the amount of time it takes for the infection to evolve. And that may be contributing to a little bit of that shift that we have in the numbers. So it's critical for everyone to understand, as the governor just said this morning, our numbers and what we are seeing is very sensitive to what you were doing in following the stay-at-home order.
Governor, do you have anything to add?
The question was directed at me, so I'll offer a few thoughts. I was not surprised. As the doctor said, I've been kept informed on a daily basis. It is, I think, good news insofar as it's a more accurate portrayal, not good news insofar as I keep waiting for the day when we see a decline. But as I said, we're not going down. We're not yet going down the curve. But it's still consistent with the plateau, and if between now and May 8th that plateau continues and all the other benchmarks are met, then I will feel comfortable. If, however, it's not a foregone conclusion that May 9th we're going to start phase 1. If, however, we start to see an uptick, any concerning data, another one, I'm worried about vulnerable communities, our testing isn't where it needs to be, our contact tracing isn't where it needs to be, we have an outbreak someplace, well, then we're going to have to pause. So we're still in a mode of managing a daily crisis, and flexibility is going to be key. But as I stand here today, based on everything I know and my faith in the people of Rhode Island to obey the stay-at-home order, we are planning for lifting the stay-at-home order on May 8th.
Christian Winthrop of Newport Buzz asked you, Governor, when you make further beach announcements, will state, town, and private beaches all have the same rules? Can town beaches impose different restrictions than state beaches, such as residents only?
Excellent question. Yes, they can, and they may. It's my hope that we, the state, will be able to provide them very quickly with guidance, and that they would look to follow that guidance, so we have a uniformity across the state. Having said that, you've seen in Providence already that the mayor took a different approach than I took for the state, which is fine. So we're going to give them guidance. In fact, just yesterday I had a call with all the municipal leaders. We're trying to stay ticked and tied together, but they are absolutely able to do different regulations if they decide, maybe someone thinks it has to be more stringent based on what's happening in their community.
Brian Crandall of NBC 10 asks, will there be an overall capacity limit at parks and beaches when they reopen, or just enforcement that people stay 6 feet apart from each other, especially at beaches where people typically sit down for a while? Will they be spaced out?
So Brian, I'm smiling because these are exactly the sorts of questions that are consuming us day and night. And sadly, my answer for you is I don't know yet. But the goal is to make sure everybody stays 6 feet apart, to make sure that we're not spreading the disease between one another. And then the question becomes, okay, well, how do we achieve that goal? And it's almost certainly going to be the case that there are going to be overall capacity restrictions, because it just isn't realistic to expect that people will be able to stay 6 feet apart unless you restrict capacity. Much as we're doing now with grocery stores. The goal is 6 feet apart. The only way you can achieve that goal is that there's fewer people in the store at any one time. So all of the work that my team and I are doing right now is to figure out questions exactly like this. How do we change the rules and regulations and then enforce those new rules and regulations so people actually stay 6 feet apart, continue to wash their hands, continue to wear their masks, we continue to protect the most vulnerable, and there's a whole bunch of different ways that we can do that.
Richard Asnoff of Convergence RI asks, what kind of testing regimen does the Department of Health envision will be necessary after the stay-at-home order is lifted?
Thank you, Richard. There is extensive work also going on how to approach testing. One is to make sure that we understand that testing is going to be one critical tool in the full toolbox of how we will approach reopening the economy. It is not a replacement of what the governor just mentioned, the staying 6 feet apart, making sure people have access to hand sanitizer, washing their hands, being able to cover your face and nose to prevent spread to people who are around you. Those components will need to be in place along with the testing component. From our testing standpoint, we have 3 general categories. One is going to be continuing the aggressive approach we're taking with clusters of cases, similar to what I've shared, how we are approaching it in congregate settings. If we have a cluster of cases in a congregate setting where we know it's a medically and physically fragile community and the virus can spread more easily, we are very aggressive in testing the staff and the residents in that entire home. We'll want to do the same in certain communities where we're seeing higher numbers. If there's one case in a housing unit, let's go and test the entire housing unit and see how we can help and provide the support that's there. Another approach that's going to be critical is what we are calling sentinel surveillance. It's an ability to use testing to help understand what's going in different sectors of our society, in some of our workforce sectors, some of our retail sectors, and in some communities that we are in. The third category is going to be continuing to have a focus on our high-risk communities. Those who are, we know have had higher rates of numbers, and making sure that we have the services in place to support them once we do the testing and activate the contact tracing and subsequent components.
Our next question is from John DePietro. Governor, why not treat high infected areas in the state and residents in those areas differently than other areas? Why treat Block Island, Narragansett, and Newport the same as Providence, Pawtucket, and Central Falls? Will any stimulus money go to undocumented people?
Okay, that's a lot of questions.
2 different questions.
Leave it there so I can keep my eye on it. So in some ways we are treating different communities differently. For example, we have a walk-through clinic in Central Falls. Why are we doing that? Because we have reason to believe that in that community, there's a high incidence, people haven't been tested, they don't have cars, they can't get to Twin River, so we went to them. Same thing for Woonsocket and Oneyville and other areas in Providence. In other ways, it just doesn't make sense. You know, in a much bigger state, that might be something that we could do. Like, for instance, I know in New York, which is a much bigger state, obviously New York City is very, very different than some of the upstate, more rural parts of the community, and people don't interact. Rhode Island is, as you know, as we all know, it's a small place. It's extremely densely populated. I think we're the most densely populated state in the country. You can get almost anywhere within an hour, which is one of the reasons we love it, but it means that it doesn't really make sense to have different, like county by county regulations, and frankly, it would be very difficult to enforce. So that's why we've made the choices that we have made. We haven't yet decided about the answer to the undocumented population. Here's what I will say. I'm concerned about it. I am quite concerned about it. Folks who are undocumented are afraid, and they're afraid to get tested. They're afraid that when they go to a testing site, there might be an immigration official there. We are working overtime to let the community know that's not going to happen. They should get tested. They should see a doctor. They should see a doctor if they're sick. If they need a place to live, if they're a healthcare worker, they should let us get them to Brown University. And so I'm worried that because they're afraid they're not going to get the care they need, they're going to continue to spread the disease, which is bad for everybody. So I want to make it clear, regardless of your political views on immigration, I promise you it's in the interest of every Rhode Islander, in the public health interest of every Rhode Islander, that everybody gets tested and is logged in our contact tracing system and gets the support that they need. And so how we do that exactly is an evolving thing, but we're working on it every day.
Our next question is from Alex Weldon at WPRO Radio. Mass allows greenhouses to be open with all social distancing. Your 427 order does not effectively allow garden centers to gain any ground. Their selling and the customer service process is stifled and counter to social distancing. Can you revisit this?
I believe we'll be making announcements on Monday related to exactly that question. So if you can hang on for a few days, I can come back to you.
And our last question for this Friday is from Stephen Triedman of Eastside Monthly. Tomorrow in Providence, Mayor Elorza is closing selected streets for people to walk and exercise and opening some parks as well. The majority of these are in the highest COVID-19 affected areas. Are you concerned about an increased spread? And does your May 8th day loosening of the restrictions tie into this?
So a key for everyone is definitely going to be making sure as you're getting outside during this stay-at-home order that it is done safely for a short period of time and people return. That masks, face cloth coverings are worn, covering your mouth and your nose whenever you're outside in public. That 6 feet of distance is used with other people in the public setting, so you're minimizing spread of infection or risk of spread to anyone else. And as often as possible, particularly if you need to touch a surface that the public touches on a regular basis, a doorknob, a countertop, that you have hand sanitizer and or access to washing your hands, and you're doing that. With those set rules in place, being able to take a walk outside is important for our own health and well-being. And so as long as folks follow the stay-at-home order and those social distancing guidelines that I just shared, our ability to keep an increase from happening is possible. But if people are not following those guidelines, then yes, there would be concern with more people getting out and increasing the risk of spread. We understand the importance of enjoying some of the weather, but it is key that everyone follows the stay-at-home order and how to do that. Go out quickly, come back, and be able to stay at home, and do it safely if you do go out.
Thank you. Do you want to add anything?
I would agree with that. I would just end by, I agree, obviously, with everything she said. This is a big weekend, so I respect the mayor's decision to go ahead and do that. People do deserve the opportunity to go outside, but I know the mayor is planning to make sure that social distancing and mask wearing is enforced. There is still no congregating outside. You go outside alone or with someone in your family, go for a walk and go home. The stay-at-home order is in full force and effect, and we're going to be out there enforcing it, as well as the mayor and the Providence Police. So, and then does the May 8th loosening, I'm not sure what that is, but you know, obviously if we get to May 8th and we lift the stay-at-home order, then people will be freer to go to parks, and it's possible the mayor would consider reopening parks at that time.
Thank you.
Thanks.